Having recurrent bad dreams can be disturbing and disruptive to anyone, whether as a child or even as an adult. However, it can be difficult to know whether what you are experiencing are nightmares or more sinister sounding night terrors. Both can result in sleep disturbances, leaving you tired and irritable the next day. Regular occurrences can also leave you not wanting to go to sleep at all, making you miserable and depressed. However, nightmares and night terrors are not the same thing, and in this video we're going to look at how you can tell the difference between them. We will also look at some of the ways to help reduce the occurrence of these nighttime events to help you improve your sleep and your life. So, what are nightmares? Nightmares are dreams with explicit, scary or unsettling content that most often occur during a phase of sleep called rapid eye movement or REM sleep. As the name suggests, this phase of sleep is characterized by rapid movements of your eyes, and in adults makes up around 25% of your total sleep time. It is during REM sleep that you are most likely to dream, both good and bad dreams, and experts believe that this helps you to process emotions and solidify memories. It is those bad dreams that occur during REM sleep that are known as nightmares, and usually happen late at night or in the early morning hours. One of the main distinguishing factors of nightmares is that someone who experiences a nightmare will usually wake up abruptly and will be able to recall the dream fairly vividly. Children may want to tell their parents about it and gain reassurance that it was just a dream and not real life. However, this can be equally true for adults, who may also need reassurance from their partner. Night terrors, also known as sleep terrors on the other hand, are quite different, and are classified as a type of parasomnia. Parasomnias are sleep disorders defined by the American Academy of Sleep Medicine as undesirable physical events or experiences that occur during the initiation of sleep, during sleep, or during arousal from sleep. Night terrors generally occur during non-REM sleep and are more likely to take place earlier in the night. Unlike nightmares, a person may appear to wake up, shout or scream, show intense fear and or flail around. They are most common in children, affecting approximately 40% of 3 to 8 year olds, although it is estimated that at least 2% of adults also experience them. However frightening they may be, night terrors are not usually a cause for concern, and most children will grow out of them as they get older. And unlike nightmares, which can often be vividly recalled, those experiencing a night terror will usually remain asleep and will have little or no recollection of it in the morning. So what causes nightmares and night terrors? Whilst the possible causes of nightmares and night terrors are many and complex, here are some of the most common. Number 1. Stress and anxiety. Stress and anxiety are emotions that people can have difficulty channeling in a productive way, and therefore dreams can be one of the only opportunities for the body to work out those feelings. One study in 2002 analysed a group of 400 psychology students and found a positive correlation between nightmares and stress levels. It was also noted in the study that the nightmares were associated with the ability to cope with stress. A bigger and more recent study in 2014 involved nearly 7,000 children between the ages of 8 and 10, and combined with a follow-up study of the same children around the age of 13, found that those children who experienced bullying were more than twice as likely to experience night terrors. Therefore, dreams, both good and bad, seem to play an important role in mood regulation or as a coping function. Number 2. Underlying health conditions. There are a number of underlying medical conditions that can cause nightmares and night terrors. Post-traumatic stress disorder, or PTSD, is one of the main causes of recurring nightmares in adults. This often involves reliving or having flashbacks of traumatic events as your mind tries to deal with and overcome the negative feelings such events can cause. It is often the case that these flashbacks can manifest as nightmares, and research has found that up to 70% of people with PTSD experience nightmares compared to just 2 to 5% of the general population. These disruptive nocturnal events can also end up exacerbating symptoms of PTSD and reducing sleep quality, which can further increase the occurrence of parasomnias. Respiratory conditions such as obstructive sleep apnea can also increase your risk of experiencing nightmares or night terrors. A 2003 study monitored patients' esophageal pressure during the night and found that people who'd struggled breathing while sleeping experienced additional sleep issues such as night terrors. The authors suggest that the increased effort needed to breathe may be the trigger for nightmares or night terrors. Other underlying health conditions that have been shown to increase the risk of experiencing nightmares or night terrors include restless leg syndrome, migraines, narcolepsy, depression, Parkinson's disease, alcohol and drug use or withdrawal, as well as certain medications such as amphetamines, beta blockers, and some antidepressants. Number 3. Genetic factors. Research has shown a genetic link to parasomnias such as night terrors. One small study found that 80% of sleepwalkers and 96% of people who experience night terrors have at least one close family member who has one or both of these conditions. A much larger and more recent study analysed the sleep behaviour of 390 pairs of identical and non-identical twins, with the results showing that someone is significantly more likely to experience night terrors if their identical twin does. On the other hand, the chance of this happening in non-identical twins was found to be much lower. Similarly, a large 2015 study found that children were more likely to experience night terrors if their parents had a history of sleepwalking. In these children, the night terrors were also found to persist for longer, and they were more likely to develop additional parasomnias, such as sleepwalking, in later childhood. So what can you do to help prevent nightmares and night terrors? In most cases, treating recurrent nightmares or night terrors involves treating the underlying cause itself. Treating conditions such as PTSD, depression, and anxiety can help resolve thoughts and feelings that may be causing nightmares. These treatments may involve psychotherapy such as cognitive behavioral therapy, medications such as antidepressants, relaxation techniques, regular exercise, and improving your diet. There is a vast amount of research and evidence for the effectiveness of these treatment options, which we won't go into detail here, but see the links in the description for more information. Treating sleep conditions such as sleep apnea can also help prevent nightmares and night terrors, for example by using breathing machines, medications, and lifestyle changes. Several studies have shown treating sleep apnea with continuous positive airway pressure using a breathing machine made violent and/or highly anxious nightmares disappear. A number of more general ways to help reduce the occurrence of nightmares and night terrors can also be important to consider. These include having good sleep hygiene by establishing a regular and healthy bedtime routine, avoiding caffeine and alcohol during the evening, ensuring you have a relaxing sleep environment, and not using electronic devices 2 hours before bed. For more information on improving your sleep hygiene, see the link at the top of the screen now. You can also see the links in the description for more information about any of the topics and research discussed in this video. If you find that recurring nightmares or sleep terrors are affecting your ability to get a good night's sleep, or you think that you may be suffering from any of the underlying health conditions talked about in this video, always seek medical advice. So that's the end of today's video. We hope you found it helpful. If you did, then hit the like button and share it with others. Also remember to subscribe to the channel to keep learning more about yourself and the world around you. See you next time.